For cartilage depletion, is surgery really required, or is there something that we can do so the body can heal itself?
Yeah, there are some techniques and there are some procedures where the body can heal itself and regeneration of the cartilage occurs. What exactly the pathology? Here the joint, the part which is at which come across to the other tibia, this part of the bone, they have the small cartilage part, that is the covering of the bone. Okay, that cartilage secretes some fluid, that is the reason we are getting some fluid inside, and that cartilage, they give the buffer. And after the in between these cartilages there are some meniscus, there are some buffer. They are the menisci. Okay, the plural is menisci. Meniscus is single one, menisci is plural one. So there are menisci, they act as a buffer at the time of walking, running, all these things. Everything is bathed with the synovial fluid. That synovial fluid means there is a lubricant fluid. That lubricant fluid is secreted from the cartilage. If the cartilage is degenerates, then the fluid regeneration is less. Then what happens? These bones, they get come together, and this menisci, they get torn. Okay, then these two bones, they come they grind against each other, and there will be a friction. Then there will be inflammation. Once there is inflammation, then what happens? There is some more fluid generation occurs. That then knee effusion occurs. So patient come with a swelling of the knee, and most of the time they once you remove that fluid, again it forms. All these things occurs. So the way you asked the question, the regeneration can occur. Yes, we can give a regenerative. There are so many regenerative methods. One of them is your platelet-rich plasma. This is very common, the autologous platelet-rich plasma. What exactly autologous platelet-rich plasma? That means patient's blood we take, and freshly prepared platelet-rich plasma we put inside the joint. That is one type of regeneration method. And we take your fat cells. Then from fat cells we take the growth factors and put inside. That is one is there. Or else we take your bone marrow. From there we take some growth factors and put inside the joint. So many procedures are there.
Depends upon the
Depends on the condition, depends on the doctor's expertise.